Hello, this is a case study presentation by Imicor Monitoring. Case Study 1. Changed diagnosis. The intensivist believed the heart was filled and prescribed dopamine. This case was done at Foothills Medical Center, Calgary, Alberta, Canada. Background. A 70-year-old woman with a history of cigarette smoking, type 2 diabetes, possibly previous diagnosis of CHF, is transferred from a secondary hospital where she was admitted 3 days prior for shortness of breath and fever and a diagnosis of pneumonia. Antibiotics were started, but she worsened and required intubation. Dopamine was started after intubation to support her blood pressure. On arrival at the medical center, the patient's blood pressure was labile, on dopamine, and ventilator, acceptable urine output. The method, a miniaturized bedside TE exam, was conducted using the Clarity probe. The probe was easily passed and a transgastric short-axis view of the left ventricle was obtained. The patient's heart appeared underfilled upon the initial examination, and a fluid bolus is suggested and given. The patient's blood pressure is less labile and dopamine is weaned overnight. TE monitoring continues. Day 2 in the AM, the patient was awake and interactive. Heart rate 79, blood pressure 105/55, CVP 10 with ventilator settings unchanged. Urine output, however, was still low. The heart still appears underfilled and more pentaspan given 500 cc's. Dopamine was weaned off over the next 3 hours and urine output is better. CVP rises to 16. The patient was extubated on day 3, out of the ICU on day 4, and out of the hospital on day 9. Thank you for viewing case studies from Imicor.